Good evening, everyone. This is Carolyn Coleman, and welcome to Gentry's Journey. Our honored guest this evening is Dr. Kina Phillips. We're going to start with the scripture. When a man ways are pleasing to the Lord, he makes even his enemies to be at peace with him. Proverbs 16:7.
Kina is a nurse. She's a veteran. She's recently Dr. Kina Phillips. She's worn many hats. I'm going to let Kina tell you about those.
I did serve 10 years in the military as a combat veteran, combat medic, and it's similar to nursing. It's pretty much like a paramedic, but it's a blend. You know, the military do on-the-job training. They're going to train you for whatever. I started as a medic. I was placed there with the ASVAB, taking a score, making high. Didn't know what I wanted to do, but my recruiter pointed me in the right direction. So I did 10 years, served 2 years in Iraq. When I came home, I decided to go to school. And when they asked me, well, what do you want to specialize in? I said, well, nursing. I've been doing nursing for a while. So on top of that, I have been a cardiac care nurse, ICU nurse. I have worked in a doctor office. I have worked in long-term care. But mostly in the hospital as an ICU nurse. My next adventure right now is I'm going to be assistant nurse manager in a cardiovascular surgery unit because I really want to impact healthcare by empowering others. So that's been my goal, is to leave my legacy in healthcare.
As we were reminiscing prior to us going live, I met you in the ICU setting.
Correct.
How long had you been a nurse in? Because time flies. It does not seem like it's been that long.
I knew you since I was a new grad nurse.
Oh, you were a new grad then.
Probably,
Okay.
but I already had the background, being
Mm-hmm.
emergency medicine, acute care. But you was teaching, and I was still new. Like I think I was a nurse at that time as an RN.
You were.
Maybe a year before then, I was an LPN for like 2 years. And you had helped guide me. I was so, learning the ICU experience, the different medications, how to think critically. You think you have critical thinking skills until you're in that ICU setting and you have to teach. And you were one of my inspirations is to teach,
Oh,
is because I want to
sweet.
give back. Yeah, I tell people like I'm in my last class again, my nurse educator. And the reason I want to teach is I've had great mentors, other people who took their wisdom and their experience and poured into me. And I feel like I have excelled and I have grown and I have blossomed in these 10 years of being an RN because of people that poured into me. And I want to give that to the others, just bring people up.
That's great. I think that's one reason I enjoy pouring into people because when I was an LPN, I started off as an LPN as well. And I was an LPN for 5 years. And I always said, after I finished LPN school, and I was going to work 1 year, and if I liked, I was going to start RN school. And that's exactly what I did. But I had so many people who believed in me and who poured into me in the clinical setting, teaching me, taking the time. They never asked me to do anything they would not do. And that impressed me as well. So I'm like, I want to be an RN just like that. I want to be able to lead people into the field and allow them to enjoy their role. Now, you would know as well as I do, nursing school will weed you in or weed you out.
Right.
So,
Really.
I think some people, and it's a wonderful field. Um, but there are some people who, once they get into the clinical part of things, they realize this is not for me. And that's when they make their exit. And it's fine because everything is not for everyone. But that is how, and I still like to teach and train because someone took the time to teach and train me. So I'm playing it forward, or I continue to play it forward, because if it wasn't for them, I don't think I would enjoy it as much. We did team nursing, whether we were so-called team nursing as it is supposed to be, we all work together. That's what I mean by team nursing. Whether
Right.
we were on the same team or not, every patient was all of our patients.
Yeah.
So I love that about it. Now, you told us about your military skills and how that kind of led you into nursing once you came out. And would you consider yourself tenured because you did 10 years in the military? How does that work?
Well, I am considered a veteran
Okay. Yeah,
because we
yeah,
served.
yeah.
Yeah, because I served. I went to I was in a combat zone. So you can say tenure. I did not retire. I did
Okay.
a time. I did work at the VA. I love working with veterans and understanding the post-traumatic stress disorder, um, how to adapt back into civilian life, having a purpose. So, but being a veteran has its, it to me, where I have had gained my experience is by living in different walks and to be understanding, because at any time you can have a veteran for a patient, whether they're at the VA or they're at Birmingham UAB or St. Vincent's East or UAB West. Um, there's 1% of the population has served the country, but everybody doesn't seek care at the VA. So you still have to know how to take care of people and how to talk to people appropriately to get the results that you want, and that's one of the things of nursing is meeting people where they are, being present there, you know, to get the outcome that you would like to see.
I agree with you. Um, Once I became a case manager, inpatient case manager, after you introduce yourself, get a little background of from your patients or their family members, and the wife or the daughters will say, "Oh, he's a veteran." I was like, "Oh, you are? Oh, yeah." I said, "Well, why don't you go to the local VA? Are you affiliated?" "I don't want to go over there." And I said, "They would love to have you." I said, "Not that I'm trying to push you out." I said, "But that's
Right.
a thought." I said, "Because they love taking care of their vets, and
Right.
you can still see your personal primary physician and go to the VA at the same time." And they were like, "Oh, I didn't know." So after a couple of years, I was like, they don't know their benefits.
Right. Or even that, like, I went into long-term care, and the VA, when you have to go to long-term care or be in rehab, they provide some of the best services and offer as far as insurance and taking care of you and making sure you have what you need when you come home. And
Mm-hmm.
a lot of veterans I've had, I'm talking to somebody, they're like, I don't have health insurance and I can't get rehab and I can't get this equipment. And I was like, or did you go through the VA, which is called Optum? If you go through the VA system, you can get that rehab, and it's no cost to you at the patient. There's no copays. I've seen
Mm-hmm.
them pay before they come home. What equipment do they need? They have it in 2 to 3 days, and the medicine is at the door to make sure that you're getting everything that you need. And not every health insurance company can say that. But if you have served your country, that I do believe, in what I have seen is that the VA, being a veteran, they go try to do above and beyond and make sure that your needs are met, so that we don't have, so many homeless people. Um, a lot of times the VA patients, they don't know what benefits. They set up with a house. They can set you up with a job for a year or two, and they try to get you on your feet so you can actually go into society and be productive. Um, but when you don't know it's there, it's not a benefit until you use it. It's just a feature of the VA until you use it. So I do think that that's something that needs to be promoted more, is what can be used for the people that have served their country.
I agree with you because when I'm talking to relatives or friends, I don't know how we get on the subject, and they say, "Oh, well, I'm a veteran." I said, "Oh, well, do you go to the VA?" "No." I said, "Do you know your benefit?" "No." I said, "You need to get established with the VA and you need to learn your benefits." And they were like, "How will I do that?" I said, "First of all, you need to make a phone call and make
Mhm.
an appointment. and see if that's going to work for you. But if you don't know what you have, then you definitely can't use it. I said, but there are benefits I have seen where one of the wives told me, "Do you know we pay over $600 a month for his medicine?" Now, this was several years ago, because I can only imagine what it is now. I said, "Well, you know, if you went to the VA, I think it would be little or nothing." And she looked at him. I was like, "Don't blame him." And she said, "Are
Right.
you kidding me?" I said, "No."
I mean,
I said, and they're not going to insist that you come to them. And they will
mhm.
still let you have your primary care physician and your other physicians, but you need to establish a relationship with the VA and see them at least twice a year. That's because they want to care for you. And he was like, I had no idea. Thus, going back to they they're not aware of their benefits.
But see, I also think it's like the same dilemma with Black people in healthcare. Once we get a stigma, and the VA has a stigma, that's not positive. But that stigma is about 20 years old or 30 since Vietnam. This is not current 2024.
Sure.
You know what I mean?
I
So
just
it's hard to beat when they had a stigma from the First World War, but the VA didn't have as many rights. The services was poor. It was hard to be seen. Right now, they have reformed the healthcare so much, but we can't beat the stigma of it. Oh, it's gonna take 2 years to get an appointment. It doesn't any longer. It's still a wait sometimes, but it's not a 2 year wait.
sure.
They also open up, like you said, you can go to your primary care facility, physician. Your medicine, you can get your medicine. They mail it to your house if you don't want to come in.
Mm-hmm.
All the equipment, I've seen them where if you need disability, like the ramps, they will build you a ramp for your house. They will give you an electric wheelchair.
Mm-hmm.
How fancy you want it. They gonna, I have just seen the better services when people are actually using it correctly. Supreme services, and they don't tell you no, like probably the stigma was they did years ago. But it's all about really connecting, like you said, establishing care and finding out for yourself and not going, well, I heard you not, no, why don't you go see? you know,
Absolutely.
why don't you go find out?
Absolutely. And I don't know why word on the street is more, for lack of a better term, more positive than you going and finding out for yourself. I call
Sure.
it street justice. You need to stop listening to this street justice. And this is not just with the VA, this is with everything.
Right.
Well, a friend of mine told me, no, we're not going to do that today. I want you to call your help, your insurance provider, no matter who it is, and I want you to ask specific questions, because this street justice will mess you up each and every time.
Right.
And they were like, are you sure? I can't guarantee you any answers, but I can guarantee you'll get a better answer than what you have. Your
Correct.
situation may be totally different from their situation. So please don't compare the two. And like I said, this is with a commercial insurance or a VA. It doesn't matter. Knowledge really is power.
Right.
And you can't expect people to come on they don't have enough employees to come knocking at everybody's door, asking them if they're a vet and if they are service connected, or if they are, are you
Right.
getting your benefit? They don't have that type of resources. But once you open the door, step in, start doing your paperwork, then you are connected. It's just so many facets of military, service
It,
time, wartime, peacetime, all of that goes into it. I don't know about it, but I hear that from people who serve vets at other facilities. Okay. So we just want you to know that you're not alone.
right.
You're not alone. So
Definitely.
I think that would be a good step for vets to take.
Mhm.
you know, the diapers, the well, just whatever you need,
Right.
they will basically supply at some
Correct.
point in time. You will get that. Now let's get back to nursing. And your latest accomplishment. Tell me about Kina Phillips, the doctor, and when all of that took place. Because I'm very, very proud of you for that.
So surprisingly, I finished my master's and in executive leadership at Walden University. And I was done. I was completely finished. But I have a daughter that's right now she works in neuro ICU as an RN, and I have my she's 24 and I have a 21-year-old that is in healthcare as well. They called me on FaceTime, a group chat, and was like, Mom, how long would it take for you to get your doctorate now you complete your master's? Like, I just graduated. It wasn't the paper wasn't even printed yet. It was just like, congratulations, you got your master's. Next conversation. And I was like, I'm done. I don't have to do school anymore. Like for as me, y'all take it. Y'all beat me. And then they said, well, what example you setting for us? You gonna quit right now? And I'm like, but I didn't quit. I'm just not starting. I just don't want to, But why not? I mean, you always say go high, go high. And I was like, that's right. So and we want to say, call you Dr. Mom. Like we want that benefit. And I'm like, I want to let y'all earn something. Because if I earn all the titles, but you got to look forward to.
Yeah.
You know. And so I looked into it and I was gonna go back to Walden. And there was a Dr. Patrician. She works at UAB. She was a general in the military. And me and her just end up having a conversation. She said, you know what, I think you would be a good fit for UAB because of your belief system, your leadership belief system, how you feel about healthcare, which I'm passionate about, that you will be a good fit. And I was like, not UAB, they're not going to select me. Not, I didn't go to the prestigious schools. I went to Chamberlain and Walden for my bachelor's and my master's. So I was like, they're not gonna look at me. That was my thoughts. And I applied anyway. I remember I applied and I stopped my application because I was like, they're not gonna select me, so I'm gonna waste my time. I'm just gonna go to Walden. And I got a call from UAB saying, hey, we were looking for you to finish your application. Why haven't you? And I was like, okay, well, I'll go ahead and finish it. And, I had the references, the doctors I worked with were from UAB. And I got selected. I was one out of 15 in my cohort, and I was executive leadership without a nurse practitioner. So I was kind of like feeling like a fish out of water. But then I was like, well, if I was placed here, it's because I was meant to be here. And I had to stop and say, you know what, why be intimidated? Like, you're different and it's okay with being different. You don't have to be a nurse practitioner. You still make an impact on healthcare. And so I had to embrace my journey. And when I embraced that journey, and 2 years later, I got my doctorate and I graduated from UAB. And I just didn't really see it like I never would have seen it, but I had to say, you know what, you're only place where you're supposed to be, you know.
That's true.
And once I went and I graduated, I love UAB. I love the networking. I grew a lot more in different avenues, in leadership of, talking to people that can help me as I do my professional growth ladder. It was a different eye-opening experience. And it was still something I added, you know. So I had a great experience. I would tell the truth on that.
Okay, I saw you do a presentation. It was a leadership presentation. What was that about?
Yeah. So I was I am a member of Alabama State Nursing Association. I'm the District 3 Vice President, which has a focus on membership. How I became that was I've always been a member of Alabama State Nursing Association, because it's important that on a professional level that you have a voice. I believe that you should have a voice. And
Mm-hmm.
to make changes, it only will come if you address it and you identify that there are issues. It's just not going to happen overnight. So I decided that year that I was going to be more involved, not just a payer. I always paid and say, for the people who want to work, here's some resources, And I'm like, you know what, why don't you become more active? So I said, let me take the leadership course because I feel like I want to grow as the leader. And one of the things I had a Mr. Chuck Lacey, he mentored me while I was getting my doctorate. He I told him I noticed that as a charge nurse, and I've worked as third-party nurse, which is called agency, and I've worked as staff. I said, well, when you are a charge nurse, there's no training. It's whose turn is it tonight? It's not an identified charge nurse. And which a charge nurse is usually identified role, which there's identified responsibilities. But every day, if I was a manager, these are not being done,
Yes.
because you're the charge nurse and you're just saying, hey, it's your turn to be the charge nurse. You don't even know what your role consists of. And I said, I do believe that in orientation that there should be, that was the problem I identified, that there should be some kind of like training, even as 1 day training for everybody that's going to be in a charge nurse role, because there's not an identified role where you get $1 more. You put your name in a book saying I'm charge nurse today, but you don't know that what books you need to fill out, what forms you need to fill out, what reports you need to turn in, how you do the schedule. You don't know anything. And so a lot of people run from leadership or run from that role because they don't know how to do it. So why not train them? So we implemented the charge nurse program, and during it, it was hard to implement it because we had a change in leadership at the hospital we were at, and therefore I identified something called the chaos theory. In that chaos theory, it says any change automatically brings chaos. So if you are a leader, you should expect chaos. And the only time a leader has to step in is if the dust doesn't settle. They say the imagery should be take a handful of pennies and throw it in the air, right? That's the change. When it lands and it's making all that sounds, if you still hear it going for too long than expected, that's when you step in and say, hey, we need to make adjustments. But usually it's going to start and settle as people get used to it. So you should want change. You should hear people saying, I don't want to do this. I don't want to do it. But what you want is that they still make the changes that you are putting in place. And you're going to see the outcomes that you want. And that's what leaders do, that they are, you begin to change, and you only step in to help get it back structured. And so there was different things I know, like, hey, I made a different policy. I expect some give back. I can't go into the give back because what do I want my outcome is? If I already expect that everybody's not going to like this idea, it's not a surprise when you hear the negative feedback.
Sure.
But you want to see the outcome. So you got to give it like 6 months to a year. And that's what the change theory is. And I've seen it multiple times in different avenues in leadership. I've experienced it even when I was the director of nursing at a nursing home. We would make changes, and this isn't what we've been doing. This hasn't, you know. But I asked them, hey, just give it a chance. That's all. Let's just try it. Let's see what the changes are. You got to give it time. It's not going to be overnight. And usually my retention rate went up. A lot of changes I put in place, I've seen an improvement. But you also got to walk people in sometimes, and that's called the buy-in. You have to have the buy-in. So.
I agree. You're going to always have pushback when there is change. But one thing we know, the one constant is change. It's coming whether you want it or not, whether you self-implement it, whether it needs to be an implementation. I love what you said about you tell someone you're in charge tonight, and they don't have a clue as to what that means.
Right.
They kind of know they need to be making assignments, but other facilities have more of an expectation when you are in charge. It's not just making the assignments and ensuring that your staff is okay, because there's some charge nurses who will not see if their staff is okay. They would never look at that. It should be more than you're in charge tonight. Voila. That's how I got my first bid at being charge nurse. I had been an RN for 6 months, and they told me, Carolyn, you're in charge tonight. And I went, how did that happen? Yeah, I did. And they were like, you've been here the longest. 6 months. But
And
falling back on my role as an LPN, I always followed according to who was in charge that night. Okay, if it was one of my team builders, my mentors, we did a lot of talking and we worked together a lot. So I had to fall back quickly, you know, to see or to remember what was going on. And she gave me my assignment. My charge nurse called me and said, "You can do this. You are bright. You are smart. You have taught me a lot. I haven't been on that unit that long, but she had been charged on another unit, and they brought her down to our unit for some, for some stability."
Mhm.
And I was like, okay. That I still had not that buy-in, but I knew I was going to have to do it. Okay. And it went well. I mean, me being who I am, I walked away for a minute and I said, Lord, Lord, go before me, go before me and prepare the way. That's what's got to happen. But we did have at that time, it was 8-hour shifts. We had a
Mhm.
great shift, and I'm not saying it was seamless, but I checked and double checked my work to make sure no doctor's orders went untouched. Okay. Because that is one of your responsibilities as a charge nurse, to make sure the orders get taken care of on your shift that were written on your shift, and that they at least got implemented, even if they weren't due until the next day. So I just put that as part of my practice to double check that.
Mhm.
And I got blowback from some of the staff. How did you get to be charged? And I said, well, I sure didn't raise my hand for it, I said, but it's got to happen. Somebody's got to do it. And it went well, and I'm thankful for it. So what
Hello?
else have you done as charge or as a leader at this point in time?
Um, so may you repeat that question? I couldn't hear you. Your volume had went out for a little bit.
I'm sorry. I said, what else have you done as a leader or as a charge person, as a manager, to bring your staff together to develop some cohesiveness? Because one
Okay.
thing I've noticed, there's a lot of disconnect.
Right.
So what are you doing to bring your staff together?
So one of the things I've always believed in, and this is what healthcare is going to, is transparency, being a transformational leader. And a lot of times, the culture has been, you have to hide. I always feel like give them the rationale. Together, this is what we do, because each role is important. Um, Sometimes my CNAs, I've had a patient care tech say, I'm just a CNA. You are not just a CNA. You're not just a patient care tech. Your role is important. You'll identify an issue in a resident that you need to notify the nurse, that we can actually provide care and have a positive outcome. I also like to do huddles, where if you do a huddle in the beginning of your shift together, this is our plan, this is what we need to do, this is our assignments, who get in admissions, then you're not blindsided. I do believe that if you give everybody, not just, okay, you're looking at the board and then going off, you have a 5 or 10 minute huddle prior to you beginning the shift, saying, hey, this is our plan, this is the game plan. What's the acuity like on all the residents, all the patients? Because sometimes someone can be like, hey, I got a real sick patient. Then you get the first admission. Do you need a
Sure.
little help? So we all can have the same game plan and kind of know what's going on in a unit as a collective. I feel like that's how I start the day. Even at the end of the shift, you say, hey, are you done? Are you finished? um Everybody good, so we can at least we usually leave together. um and I think that's what helps bring teamwork, because you shows that you care. You're not just, okay, it's all about me, I'm about to go. you know um but just trying to have, hey, um identifying your team, who's strong in this area, are asking questions. I had a nurse that say, I like to get my patients in the beginning of the shift. So when we're doing the admissions, I'm like, do you want the first admission? But you just had it yesterday. But we're saying it in a group huddle because we know what you prefer. If it's your, we're looking and talking about the first and who's getting the second admission or whatnot. And usually they give respect. Hey, you know what? You're the charge nurse. I'll take whatever you give me. I said, okay, I'm just trying to respect what you like, but that's within my capacity. And I think that's where you earn a lot of respect. And this might be a stronger nurse that used to be like, I don't want to do this. And I'm like, a lot of times it's respect. If you talk to them with respect and say, hey, I understand that this is how you like it. I'm trying to accommodate what you like to a degree.
Absolutely.
Because, you know, hey, you know what? I can take is whenever I get, I'm conforming, but I'm not trying to make you conform. You get, but
Absolutely.
hey, hey, I know you're trying to work for me. I do whatever you ask, Kino. I usually get more people don't mind helping me because I'm like, hey, my job is to try to help you, empower you in your role. How can I empower you? you know,
Well,
what
that's
can I
true.
give you?
That's
Yeah,
true. When it's within reason, when a person makes a request, it has to be within reason.
right,
And some people like to get their assignment. I'd rather be full than have an empty bed. That's just me.
right.
Okay.
That's me. That's
In my section, just let me start off with what I got.
right.
And I appreciate that.
Right.
Um, and there are some people, yeah, I'll take the first admit. Okay, so you find out people's preferences
Mhm.
and you try to accommodate them as best you can. Nothing's 100%
Right.
because patients aren't 100. You can't bet that a patient will or will not come. You might get two at the same time. You know,
Right.
so you do have to, hey, we got to maneuver this because I don't
Mhm.
mind helping admit a patient if it's not my patient. I don't mind jumping in and helping out. That's not a problem, but
Mhm.
there still needs to be a degree of team effort in all of it.
Correct. And so that's where I do, if you ask me my experience, I don't have a long list of experience, but doing the huddles, that puts everybody on one page.
Okay.
We say, hey, we know your team. If you working, we know this nurse likes hers early. A lot of times we're coming in with 3 patients and we're topping out at 5. I personally like to be, give me mines. Give me my first admission. Let me knock it out. I don't like getting admissions at 5 in the morning. We can't predict it, but
Mhm.
at 5 and 6 o'clock in the morning, the last minute, and you giving out med pass. I'd rather have time to look at the person, look at the notes, make sure their labs are done. I prefer mine early so I can get in my rotation. you know,
I
I
agree.
don't, you know,
I agree.
um, so but and there's some that be like, no, let me be last. They just wait. I just like to get mine on out the way. you know, like you said, let me get my 5 or let me get my 4 in the mission. Let me get my mission so I'm locked up. I
Yes,
don't have to, I don't, I rather get it. It's not work. I'm here to take care of people. So
absolutely.
trying to avoid taking care of a patient, that's not who I am. That's not my work ethic. Just give me my people.
I
And so I
agree.
can help people because if I can get my people settled, I don't mind helping no one else.
Sure.
And that's um I just like to have it done, put my orders in, and I don't like at 4 or 5 in the morning. Sometimes I feel rushed.
Sure.
5 or 6, you're rushing because you're trying to go home. So
Absolutely.
you might not be as detailed, and I
Hmm.
like a little bit more detail. So I rather have time to go look at things, and that's my personal preference. So I usually when they say, "Kina, you want the first submission?" Sure do. But you had it yesterday. That's fine because it makes my job easier, and I'm a helper. Somebody
Sure.
gets something light, I might be going in someone else's room. Hey, you
Hmm.
need this, so you need that. We kind of do it. I do feel like most nurses do that. Um, and I don't want to say ADHD. I like to be busy, so I'm walking around and okay, what you need. Um, to be, especially when you're in a leadership position, you have to be a resource to other people.
I
Um,
agree.
if you're precepting someone. That doesn't mean you won't have patience, but you're still gonna have to have your patience and to help somebody. I'd rather get it on out the way as a leader. Let me have my people. I know how to get them settled, and then let me go help others. So
Absolutely. Yeah, you have to take care of your load first before you can help someone else, unless an emergency pops up,
right,
then everything's on hold and we go to
right.
what we know. Now, do you think your time in the military helps you with your way of processing a leadership role?
Yes, I really do because I script a lot of my behaviors over what I've seen. Even the huddles before you leave, before we went on convoys, we always did a huddle. And then when you get done with it, you do a huddle. I see it even on our crash carts. When we have a code, they have the after code review. In summary, you supposed to go back and analyze. If somebody fall, you have a post fall review. What could we do to prevent it? What went well? What we could have did better? And that's something you always healthcare is always continuous. You should always at the end of the shift, I'm looking at, okay, this happened on my shift. What could I do better?
Mm-hmm.
What can we do better as a team? Because I want my performance to get better. You should always be analyzing yourself. You should always be evaluating yourself. So I take that same leadership. I was 20 years old teaching classes to people older than me, teaching
Sure.
BLS. And they did me the same way. Hey, you the medic, and I was attached to a military police unit. I was the only medic. So when it was time to do first aid class, this is my first time at the unit. I'm just there. I don't even know where to get supplies. And they said, "You're the medic. You got to teach the class." And I was like, "What you mean? I just got out of school." Well, you're the subject matter expert at this moment. I'm 20 years old. Huh? I got to teach the class? Yeah, teach us what you know. And that's on the job training. I just was out teaching other people how to take care of them. And what I had to realize is I'm going to teach you what I know because the military says you're only strong as your weakest link. If I hold back any information, it's not beneficial to me if I become the patient. So I'd rather you know what I know, and I'd rather take the knowledge to other people and share it so that the outcomes are better around the board. But me holding on any information is not beneficial to me in the long term.
I agree.
you know,
I agree.
And so that's things that I actually do. I'd rather share, hey, let me show you this. This is what I do. You don't have to use these time management skills. Um, this is how I do it. Um, this is what I recommend. If we're in a learning environment, you're being trained. I want you to understand that you're gonna have feedback. Just because somebody gives you feedback, it's not to hurt you, but that's why you're in a learning environment. So that if you make an error, you have time to fix it before you're on your own.
That's very
And there's
true.
nobody there to fix it for you.
Yeah. It's just troubleshooting.
Right,
You didn't see this coming. It happened. Now, how can we best handle this situation in the future?
right,
Because you cannot predict every scenario. You're just doing best case scenarios
right.
at this point in time. So every day is a day of opportunity. Every day is a day of learning, in my humble opinion, especially when it comes to healthcare.
Right. It is.
Now, when you what was your leadership project that you did as you were, I think you were finishing up your doctorate before your graduation ceremony? What was that?
Okay, so that one, I didn't do a leadership project. I did do my doctorate project, and it was uh developing a standardized guideline for postpartum mothers at UAB.
Oh, great.
And so what it is we tested or screened mothers 12 to 24 hours after delivering a baby to see if they had any signs and symptoms of postpartum depression. Um, and then we can begin treatment earlier. Right now, the standard of care is it was up to the doctor's discretion. If, oh, I think you got depression, now we'll screen you. We wanted to be everybody is screened so that we can identify those that have postpartum depression or could have it earlier before they actually become severe symptomatic. Usually they don't find it until they really just express themselves in tears when they could have already been on some kind of medicines or some antidepressants prior to actually having the bad thoughts. Does that make sense?
It does. It does. Okay, in your research or in your study for that,
Mm-hmm.
do you think the women recognize their symptoms early or later?
I really, in our study, we found that there were those that had symptoms of postpartum depression early. I mean, within hours of delivery. I don't think the females understood that they was having these symptoms until we actually, hey, answer these questions. And you scored at 9, you scored at 10, and I think it goes up to 13. And that's when you're flagged, you know. They our guidelines right now is 10 or greater, you get treatment or you're flagged for social work. We kind of believe like 8 or 9 that they should have a follow-up, because usually if you're feeling like this on before going home, we don't know what your home situation is if you don't have a support system. Now you got babies with diapers. You know, there was plenty of factors that increases your risk for postpartum depression that is going to show up after you have the child, like within the first 6 weeks of actually having a baby at home. So I think that there should be more awareness to it, because right now, when we started the study, 1 in 8 women will have postpartum depression. Within the 2 years of us doing the study, it has went down to 1 in 5 women are predicted to have postpartum depression, with 50% of people being underdiagnosed still.
Okay.
So that means that 1 in 5 could be 1 in 2, every other woman. One, there's a stigma against postpartum depression. They hear the questions and they're gonna ask, "Oh, I'm fine." That's not. So we don't even we are assuming that sometimes the questions are not asked or answered to truly be treated, if you, for lack of better terminology. Um, we seen some people that turned around and tried to harm themselves or harm their children.
Mm.
But we look at this, what their screening scores, it may be low because they hide the fact that, yes, I'm sad. Yes, I have thoughts of harming myself. A lot of people may not admit to that because they don't want that stigma, or they feel, well, they're gonna look at me bad. They're gonna take my children. I don't want my children taken away. But you're really saying, I need help.
Yes.
You know, there's the difference, saying, hey, I need some help. And I think that's where the stigma has to be changed, because how can we help you when you're scared to get help because you're going to take my children because I'm thinking about harming them or myself. And it's not an actual something I'm putting in a action, but I need some help to go through these feelings of having a baby.
I get that. And I think sometimes people give you the answer they want you to have and not exactly the answer in which they are feeling.
Mm-hmm.
Does that
Correct.
make sense?
That's true. Um, One of our studies did show that, we have a strong Latino base. It's a lot of
Okay.
Hispanics. Um, right now, our studies was wonderful because it actually showed a correlation to what the CDC had about
Mm-hmm.
the diagnosis. Is our study only focused on English speaking people, where the ones that did not need a translator. Do you know it was 68% of people we could not screen because they didn't speak English? So
Wow.
how many of those people? Because we say, well, we got a Spanish version of the screening. Well, you don't speak Spanish, you don't read Spanish. So how are we really treating the people? We have one translator in the clinic, that and some of the factors are being Hispanic causes you to be increased risk for postpartum. Speaking a foreign language, not having a support system. Well, you done came from Mexico, and your mom and your dad is and your whole family is still in Mexico, but you here. So you don't have support with these kids. Having multiple kids under the age of 5. Most Hispanics, not all, a lot of them that was taking it that we had to avoid had stair-step kids.
Yes.
The age of 5. That puts them at increased risk. Being poor social and economical, not having a lot of money, basically. There was a lot of risks, and I'm looking at a group of 68% of the women that gave birth, we could not screen because we had a small subset of population we were screening in a 6-week period. So imagine out of that 68%, how many people were probably going to have a high risk for postpartum depression that wasn't even screened.
Yes, absolutely.
They won't get screened till maybe at 6 weeks.
Okay.
But we were screening before going home, before discharging from the hospital. So that was the pilot study of screening people, young ladies, before they go home for postpartum, and then following up with them in 2 weeks if they had a higher, if they scored higher, and if they scored normal, then it would be their regular 6 weeks checkup that they would get the screening.
Okay. I was gonna say most people are in the 2 to 4 days. And did you have were the obstacles in screening those people in that short period of time? And if there were, did you screen them later? So you answered that. That's perfect. Thank you. Okay. So that is interesting to know, Dr. Phillips, that it is. Now we're about to come to a close. Your future has been so all over the place in such a positive way. You truly have inspired your children and your coworkers and your friends, because when you got on that train, I mean, you moved forward. A lot of people just stop at, well, I'm just gonna get my bachelor's and I'm gonna be okay, and that's fine. Whatever whatever your goals are, and that's just not you personally, that is just people in general, whatever your goals are. We applaud everyone for that. It's just to see that your rise from student nurse to doctorate, I just really appreciate it. I thank you for doing that for yourself and for your kids and for the profession. Because someone can always learn from someone if they just take the time to do so. Because you can be an inspiration to someone who is at this point an LPN, and they'll say, well, I'm just the LPN, and I always own my LPN. I was an LPN for 5 years. I said, oh, baby, I was an LPN for 5 years, and I don't regret any of it. Okay. And here I have slowly came forth. I was not going to obtain my master's. Okay. I was like, why do I need it? I am doing well in this role that I have. I'm able to move up. I'm able to matriculate through the system and do well in whatever position they put me in. And my daughter walked in one day, Mom, why don't you get your master's? I said, you would come in here with that.
Right. Then it's the doctor, right?
Yeah, so because she has hers, and I'm like, I'm happy for you. I'm happy for you. I said, but the thought never left my head. Okay. And because I was like ready to brush it off, but the thought never left my head. But so I was able to complete my master's. I'm glad I did. And that's all I can say. I'm glad I did. I learned a lot. It's not in nursing, it's health service administration. And so I learned various aspects of health and health
Mm-hmm.
related topics while matriculating through. And I'm glad I did. Like I said, you can always learn something,
Correct.
and so it's good to just keep an open mind. And I've always told my docs when I had to call them and confer with about a patient, I said, now they were like, well, Carolyn, we don't really have to do that, or what do you think? And I said, well, doc, I'm a forever learner. So whatever you want to tell me, teach me, show me, I'm all about it. And they just open up and just pour into you. So that's a good thing.
Mm-hmm.
Now, where do you see your future in a couple of years?
Yeah. So, a couple of years, I do plan to. I want to be in leadership.
Great.
I'm in leadership. I probably um want to be teaching. I
Hmm.
want to give back. I just want, you know, that's where I really see myself. I think I'm still gonna be working. I like to be in the middle, still kind of. I'm still where I'm at in my career at this moment. I still like to be at the bedside, so I probably want like a management position. I don't,
Hmm.
because I still like to be one-on-one. I still like to see patients. I still like to have some direct relationships with my staff. Um, I like to nurse because I feel like sometimes in leadership, you're still a nurse. You're just a different type of level. You got to wear different hats, but you're
True.
always a nurse. And I kind of like that impact where I can make some impacts on people and talk to people and level people up. I like to see people grow. I get more of a personal gratification from seeing other people grow. So I
So
want to
do
be
I.
able to see that,
So do I. We need good nurses.
Right.
We need good nurses. We need more and more of them. So I agree with you, just being where you can assist them in that growth process, in
Hmm.
that learning process. Well, that is wonderful. Um, thank you so much. Any closing remarks?
Well, I want to say thank you again for inviting me on this interview. I also, for anybody listening, to make sure that you become an advocate for yourself, join some of the personal, professional organizations. I have, and I feel like that's been one of my inspirations. There have been a lot of support. Um, from different organizations. I want to give a shout out to Birmingham Black Nurses Association
Yes.
because those, to be honest, that was another me being exposed to so many different Black women that were young that had these wonderful degrees and wonderful careers have been a motivation for me because at first I'm like, it's not gonna happen to me. But when I see other people and I seen the pouring out, the mentorship from you, I can name so many different people that I have looked up to and mentored. I want to give back. You just, joining those organizations help keep you on a good path. Alabama State Nursing Association has helped me become on a great path. I do think that's important. Is you got to have a support system to kind of keep you on this track with your career.
I
So you
agree.
won't
You do.
settle.
You
Yeah.
do.
You won't settle. It's nothing wrong with settling, but sometimes you don't know how far you can go if you don't try. And sometimes we get complacent. And when somebody say, hey, I would like to see you do something more. And hearing that, even when I was a new grad, you told me that. And so when I say here I am, it's so many people that have given me words of wisdom, words of advice, encouragement, show me in their beliefs and attitudes who I would like to be. Just, that's very important.
It is important. It is great to build people up. It is great to encourage people because you never know where they are that particular day. So if you can speak some words of comfort, support, encouragement into them, you don't know how much that does for them that day. That gives them that extra boost to keep going. Because that happened to me a lot when I was in RN school. Some of the LPNs would say to me, keep going. Don't give up. We need you. We need you to become an RN. And I was always appreciative because I didn't even know they knew I was in school.
Right,
Does that make sense? And
right,
I was appreciative of that. You know, they were motherly figures and co-workers at the same time. So it's definitely beneficial, you know, to be able to speak some words of encouragement into
right.
someone.
But thank you again for being one of my mentors. You know, if anybody doesn't know, one of the what is a best-selling author in the nation, in the world, you know, I've been attached to greatness for a long time, and I appreciate it.
Thank
One
you
day
so
I'm gonna
much.
have my book, and just know that I followed behind you. I got me a book. I'm a best-selling author.
That's right. That's right. That's right. Everyone has a story to tell.
Hmm.
And no one can tell your story like you can, okay?
Right.
So when
Okay.
you set your mind to write your story, I know a publisher for you, okay?
Okay. So when
All right. Thank
all
you
right.
so much. You have a good
Thank you.
evening.
You too.
Okay. Dr. Kina Phillips, everyone. Thank you, Kina. You have a wonderful day.
You too. Bye-bye.
Bye-bye.